Okay, welcome everyone. I'm Donald Weeks, the founder and CEO of ClearPath AI and host to the Clinic Efficiency Podcast. Today, we're joined by Jason O'Neill, the founder of SadieCare Health Services. Jason, your LinkedIn profile highlights your extensive experience in scaling businesses and your passion for leveraging technology to improve healthcare delivery. It's truly impressive how you've grown SadieCare from a side venture to a significant player in the pediatric in-home nursing. Welcome, Jason.
Thank you, Donald. And it's good to be here. It's been quite a journey to get to this
Yeah.
point. So yeah, I'm happy to share.
Sure. Well, if you would, Jason, tell us a little bit about your background and how you started SadieCare.
So my background is, fairly stereotypical. I went to Georgia Tech long time ago to study industrial engineering. Got to work for some great companies, the Home Depot and Gap, and particularly Home Depot here in Atlanta, my home, and Gap over in San Francisco. Got to travel abroad. So those were great experiences. Got to meet a lot of different kinds of people. Moved back from San Francisco some years back after getting married. Typically how people do, you move back home after you get married, and started thinking about next moves. And my grandmother had passed a couple of years prior to us moving back from San Francisco. And none of us liked the way really that all ended. She had to go to different nursing homes. We grew up in rural Georgia. A lot of those nursing homes weren't very nice at the time where we were. And it would have been great to be able to take better care of her at home. I had some friends that were in the industry already in home health care. They were doing different experiments, doing different things with personal homes. They told me about their experiences. And that was about 4 or 5 years ago. That's when I started looking at this as more of a side venture, to your point, because I was still trying to do consulting, doing other corporate jobs, even looking into cybersecurity. At some point, I jumped around to a few different companies. And a few years ago, I had some friends come and ask me about home health care, and I shared with them some of the things I've learned over time. They really encouraged me, based off all the information that I had gathered over the years with working with different kinds of people, to get more into it and to really try to do it as a full-time venture. So that's kind of a part of how I ended up at this point. I did join the marketing accelerator program, which was very useful. Joined another consortium of home health care providers, especially helped on the compliance end of things. Yeah, all of that was able to mix well together over the past few years. And now we're here where we're able to, say that we're on pace to get to about $2 million in revenue this next year. And we're going to be able to do more things in the community here just based off the work that we're doing with special needs kids and adults here in the Georgia area. So it's it's been quite a journey to get
Yeah,
here, but yeah, we're very thankful that we're able to get to this point.
excellent. Well, Jason, SadieCare focuses on pediatric in-home nursing and
Hmm.
caregiving services, often through government programs. You mentioned the goal of simulating a white glove community neighborhood service at scale. Can you elaborate on how you envision achieving that personal touch while pursuing ambitious growth targets like 2 to 5 million in revenue?
Yeah, it seems like in this industry, it's been a either or. I believe a
Hmm.
lot of the larger companies that you'll see now that are in multiple states that have been purchased by these larger private equity groups that are saying they have revenues now in the 80 million to 200 million range, even. A lot of them did start as smaller white glove companies. The founders of the company are the ones working. Usually they're the ones that are meeting with patients, driving to patient houses. And that personal touch is very important to me and my partners that we still work with at SadieCare. Scaling that is an issue, though. I mean, it will get to the point. I believe the founder of Slutty Vegan had a point about this a few months ago when she was on a podcast. She was like, wow, it's gotten to the point where I don't know all of my employees anymore. And that does typically happen in this industry as well. You get enough clients and you get enough employees working for you, you might not be able to touch everyone the same way. And I think it's important when you think about scaling is that you have to define the culture of your company and your organization And as a leader, you do have to make that important to all the people around you. And the leaders, the other leaders that work with you at your organization, also have to make that a priority with the people they hire. So, just as Home Depot has continuously put their entrepreneurial spirit throughout their corporate employees over the years, it's one of their core tenets. One of our core tenets is going to continue to be that work in the customer service and customer success realm here at SadieCare. So that's one important way to scale. And then also, and I know we'll talk more about this later, you will people, if they're able to relieve themselves of some of the more repetitive tasking and things that they have,
Hmm.
maybe there'll be some help from AI and certain systems to help them do that. It gives them more time to touch more people in a human way, which I think touching people in a more authentic way will be important currency in the new world that's going to evolve from everything going on. So we'll definitely have that top of mind as we continue to scale, grow bigger. So we'll have to do those two things. We'll have to continue to carry that touch with us, even if it's not me or some of my other leaders personally doing it. We'll have to establish that culture. But at the same time, we can get some help from some of these new systems and everything else that are coming up to give our staff more time to give that touch.
Absolutely. Well, you've emphasized building out SadieCare's infrastructure, including using various CRMs and connecting them to healthcare programs with an eye towards duplicating your model in new locations like Jacksonville. What have been the most significant change or challenges and unexpected wins in solidifying this operational foundation, especially within the context of healthcare regulations?
Hmm. So, identifying CRMs and different infrastructures that are healthcare and HIPAA compliant that take care and they help you and your organization take care of your customers' information as well, and they help you stay on task from a compliance standpoint with different health and regulatory bodies within the state and within the federal government. There are plenty of companies and plenty of programs that are just right there available to help small and mid-sized businesses do that. So that part of it, scaling and picking a company to help you isn't exactly the challenge. I think, in my opinion, is finding the right almost partners, the human partners to help you do that. Like, who is going to be there to take calls from you later in the evening when you have like questions, right? Like, which companies are going to help you grow, and they know if you have to pivot here or there, they're going to be flexible enough to help you do that. I think those things are important, and you'll find those challenges when you have to make different decisions, when you have to pivot, which companies are going to be flexible enough to even help you make those decisions about pivoting, because that's just one thing that happens when you do things with smaller and mid-sized businesses like this. I mean, you have to make a lot of different decisions, and you actually have to go in different directions. So which partners, which companies, which collaborators are going to be the easiest to do that with is the main thing that we look for when we think about like partnering with some of these different companies and also having different solutions, different software based solutions.
Yeah, having strategic partners is critical. And talking about Jacksonville, where have you seen any special or anything different from what you're seeing in Georgia? I mean, any special things you have to worry about?
Well, there'll be different regulatory things,
Hmm.
whether we have an office in Florida, North
Right.
Carolina, Alabama, Indiana. They all have their different each state has their own different regulatory challenges. We are the United States after all. And so, yeah, especially when you start thinking about healthcare regulations, a
Yeah.
lot of states, they take the ball and run with it. There are similarities for
Sure.
sure. And some states have more similarities than others when it comes to working with medically fragile children, leveraging waiver programs with Medicaid, things like that. But as I said, lots of those states, and there's different companies here. There's lots of partnerships that you can form to help you get over some of those more compliance and more of those regulatory humps, even staffing. The important thing is finding and talking to and linking with the right ones for your business and for your style of leadership and delivering to your customers. So that part of it won't be I don't think those parts of it will be the big challenge. The big challenge is just going to be like every other business challenge, is establishing the footprint, getting leads, getting customers, gaining trust. Very old school. Like those will be the things that are the hardest part about moving and extending. The very old school business questions will be the ones to make or break you there.
Yeah. Well, quality and compliance are your third pillar for 2026.
Mhm.
In a field as sensitive as in home pediatric care, how do you ensure SadieCare maintains the highest standards of quality and navigates the complex landscape of healthcare compliance?
Ooh, these are good questions, Donald. And these are questions that we actually ask ourselves every single day. Hey, are we doing this right? Do we know what we're doing? And if we don't know what we're doing, can we find out and find out quickly before it costs us too much time or, in a lot of cases with companies here, too much money? So, yes, that's why quality is definitely our the third pillar. So we have to look at compliance in three different facets. We have to look at it from the standpoint of all the employees that we have to file and work with us. Many start as 1099s before they're converted to employees, and we also give them flexibility how they want their taxes and benefits and insurance handled. So we try to work with all of the nurses or caregivers that have to go into the field for us with those, like once they become part of SadieCare. So we do have to look at the employee compliance part of it. That's very important. And also the compliance on our clients. Like, are we keeping their personal information as close to the vest as possible? Are we taking steps according to our own privacy and information policies that we formed over the past year to ensure that their information is protected, to ensure that we don't have any data breaches? I had to take some of this from some of the cybersecurity things that I worked on, but actually the biggest risk now in terms of losing information isn't someone coming and hacking your system, just like one of those Jason Bourne or one of those spy movies that you see on TV. That's not the biggest risk, really. The biggest risk to losing security, honestly, is just losing a flash drive in a hotel or just leaving your computer unlocked and someone taking your computer and being able to get into it, right? Like those are some of the larger risks when it comes to security. So it's making sure the employees are up to date on those things. So there's the client record keeping. So because you have really sensitive information on each and every client and patient that you have. Definitely have to make sure that
Exactly.
doesn't get out and that the state's able to see that you're not just taking care of that information, but you have it all. So you have the employee information, you
Yeah.
have client information. And lastly, you have the compliance on each and every visit that we do. Like if we have even visits that are not waiver visits to Medicaid, we have to ensure that the parent has done what they need to do so the state can go back and see that the visit happened. Usually that's with signatures, that's with notes. The employees are leaving notes on all their visits, and the systems that we use are approved by the state. So there's only certain software that you can use to submit information, especially for visits that they consider to be unskilled visits. There is some detail there that's not that important for this podcast, but you do have to choose a software that the state has said, like, hey, their systems are compliant. You can use them to transmit information directly to us. So that helps parents because they don't have to invoice or bill us or anything like that. We can just take care of it all while we're servicing them. But you do have to make sure that the information before you send it off to the state has all the necessary signatures and notes and the timing was correct. You basically have to be able to prove that you did what you said you did. So yeah, I know there's a lot of talk in the media these days about things that have happened in other states like Minnesota when it comes to daycare work and things of that nature. I can guarantee people that's probably not what they think it is. The state could very easily say a healthcare provider in Georgia committed a fraud by saying that they had a visit that said that was done Thursday that really happened on Wednesday. That could be labeled as a fraud case, for example. So I just want people to just be careful out there. Like, hey, if you see something where it's just like, oh, hey, there's $100 million worth of fraud here, do yourself, go down one level deeper to see like what exactly that they mean by fraud, because fraud could also be characterized as mistakes. So just,
Exactly.
yeah, yeah.
Yeah. You were talking about waivers just a few minutes ago.
Mhm.
Does that relate to the GAP and the NowPalm waivers, or are there others?
They are related. Now, comp is a waiver that you can use to service people who the state considers to be adults. So that would
Okay.
be people over the age of 22 that
Right.
have disabilities that won't be able to 100% take care of themselves on their own.
I gotcha.
And it's a
Okay.
very important thing that parents in GAP or in different programs that have Katie Beckett waivers in the state need to think about, because not just the humanistic side of it, where parents are taking care of their children, and once they become 21, 22, and it's like, well, they're not going to exactly go to college, get married, get a job, and move out, like you would think your kids do. They might have to keep taking care of them. So the now count waiver is in place to help parents or guardians of those people continue to help and look out for them. And it does that even at various levels of any spectrum that they're on. So just based off medical need. So yeah, they're related. They are different waivers, and they do have different application processes that parents and guardians have to consider. There's a major wait list for NowComp actually in the state of Georgia. So if you have even a 15 or 16-year-old that you are getting assistance with now, that's when you actually need to apply for the NowComp waiver program. You need to do it literal years before they have to get onto it after they turn 22. So definitely
Wow.
something to think about there. But yes,
Right.
to your point, yeah, those waivers are connected, but they're not automatic. They're not going to automatically
Right.
move
I
you from
got you.
one to another. You still have to go through we
Right.
call it the rituals there that parents have
Yeah.
to do. Yeah, the parents have to do a lot of work when it comes to these
Yeah. Well,
things. So yeah.
that's good to know. I didn't know that myself, but that's good.
Mhm.
During our preliminary chat, you had expressed interest in how AI can assist with communications and workflow automation, particularly with the HIPAA compliance in mind.
Mhm.
How are you currently exploring or strategically thinking about integrating AI to streamline processes like document management and interclinic communications while ensuring that the patient data security and regulatory adherence is complied with?
Now we get to the meat of it, right? Like, hey, how can we put these AIs to work, and what can they do for
Yeah.
us like right now, right? Versus
Right. Right.
a couple of years from now. Well, one
Yeah.
thing I would say as a healthcare provider, regulated healthcare provider within the state of Georgia, I definitely do have to follow the state's lead when it comes to this. And based off our assessment on what the state of Georgia has put out in terms of their technology regulatory body, we all have to proceed with caution. So that's what we are going to do. So in terms of, especially when the state puts out things about like, hey, there has to be a human oversight here, that's kind of how we were thinking about it as well. So for instance, there'll be other companies where people would be like, hey, we have AI agents here that are just trading information with each other, right? That could be, and so you could think about that first, like, I could use some of these to move patient information from one regulatory body, like, hey, I have an occupational therapy clinic. Their agent could do a referral to an agent that we could have. But I would tell someone, this sounds like the future to a degree. And I'm not sure how far in the future that is, because you have to have some human oversight there before information is traded. So I, I could sound a little conservative technology wise saying this, but because the security for these things, and maybe this is my cybersecurity background, because the security for these things isn't 100% there yet, you're probably going to see some slowness in terms of how heavily regulated industries use some of the more communication aspects of agent to agent interaction, just because there's almost no way to secure it because it's so fast, right? And that's interesting because communication is something I pointed out as something that, oh, there's definitely room for improvement here. I mean, we still are receiving faxes of patient information many
Yeah.
times before we're
Yeah.
able to take that information and develop our own nursing care plans for patients. We are literally waiting on emails and faxes from people in medical offices. That's something that can be done with a snap if you just allow an AI to say, like, I've read this personal treatment plan. I'll write this summary. I will send this summary to SadieCare Health Services AI agent. Then their intake coordinator can take and load that in the system. You've now
Yeah.
turned a 2 to 3 week back and forth process into something that can maybe take 10 minutes.
Yeah.
So
Exactly. Yeah.
sounds great. In terms of the state being like, hey, is it okay to summarize personal PII like this, then send that PII through another system that is talking from one AI to another? Like, is this okay to do? And the state of Georgia, basically, in my opinion, from reading the work, I'm not a lawyer, but basically what I've read that the state technology body put out, it said like, no, this is not okay yet, and you better come tell us before you do it. And I have a feeling everyone would be kind of scared to go ask, right?
Right.
Like, so there's going to be a bit of avoidance there. But yeah, in terms of helping using some of the AIs to help build your infrastructure, I think that's where you could really you can go to town there. But in terms of using for communication, uh, summaries, actually medical input coming from an AI that's not a person, that's unsupervised. I know the state of Georgia is going to be pretty conservative when it comes to that, and I'm not sure about other states, but
Right.
yeah, you're gonna see some lag there. Whereas you would see it's an obvious something that AI could obviously help with in theory. You're gonna see some lag there when it comes to state bodies or other regulatory bodies working with this,
Right.
just because of the PI, everything else that you have to consider, and the security
Yeah.
flaws and risks that haven't exactly been built yet. I mean, we have something here that's cool to use, but we haven't gotten the bounds about it yet. Think about it. Maybe you could think about it in terms of buying cryptocurrency and it's the year 2009 as opposed to 2026. It's much different now than it was when everything first came out. Still kind of the Wild West out there. And the state of Georgia is like, we can't have the wild, you can maybe have the Wild West when you're thinking about tokenomics and moving things from like hard wallets to soft wallets. Maybe that's more of a ground for the Wild West. By no means can you have the Wild West going on with people's personal information. And there's HIPAA compliance and everything else to consider. So, and that'll cause a little natural slowdown, but I think it'll be a good thing, in my opinion.
Yeah. Yeah. I see it in a lot of different practices. The doctors are using the AI for assistance, but
Hmm.
they make the final decision. The AI may suggest, a certain diagnosis on a kidney, as an example, or whatever, or a treatment plan. But the
Hmm.
doctor themselves has to come in and say, hey, this is, I agree with this, and this is my recommendation. But they just use it as assistance, which is I think is very good. It helps speed the process up. uh, the onus is not on the AI, uh, software. It's on the practitioner.
Donald, you're the expert there when it comes to AIs being used
Yeah.
in like clinical work. How far away do you think we are from them being comfortable enough to let AIs kind of speak and do more, the agents to do more things on their own when it comes to medical diagnosis and things of that nature?
Yeah, they're doing a lot of diagnosis right now, but like I said, it's not the final word.
And it won't be
Practitioners
the
and
final word for a while, probably.
right, and the regulatory bodies have said the practitioner has to be the final word. The doctors are not giving up their experience and their education, to an AI, agent. They're using it as a tool to assist with their diagnosis. So they're taking inputs from the AI and from some other areas as well, but they're the ones making the decision. So they're saying by doing it this way, yes, we can move along much quicker. And we're
Hmm.
starting to see a lot of different diagnoses being done, from kidney failure or kidney stage, and the different types of problems with that, as well as heart and
Hmm.
certain types of valve diagnosis. The AIs are doing that very well, and the doctors are using that as assistance, but they make their own. The final word comes from the doctor,
Hmm.
so that's and the regulatory bodies they're okay with that part. They just don't want anybody trying to give it up to the AI.
Right, or anything that could be seen as unethical. Yeah,
Right,
we
exactly.
also have used AIs to help us build the structure around our assessments and everything else. Of
Right,
course, our nurse practitioners on staff
right,
make final calls, but I mean, they've been very helpful in helping us speed things up in terms of building the infrastructure, building our templates, guiding some of our nurses down, like asking the right questions based off of certain diagnoses that some of our patients have had.
exactly. Yeah. No, that's very good. Well, Jason, SadieCare is at an exciting growth phase right now, having 10x your revenue in a relatively short period of time. Looking ahead, what specific marketing and sales strategies are you finding most effective to consistently add new patients and achieve your revenue goals beyond traditional referral networks?
So we've experimented with using different ad campaigns
Okay.
online because we're in an increasingly more online world. And a lot of our parents, even though a lot of them do, some of the parents we have skew older. And that matches with the country's overall birth rates. People are typically older now when they have children, but they are searching for more and more things on the internet. And they're searching for more of those things on the internet with their cell phones, much less with their laptops.
Right.
We've built a lot of our CRM to add analytics and capability around tracking people, how they usually look for different types of medical aid online. And you're starting to see an increase. I'm not saying it's the majority right now, but you are seeing an increase in parents thinking they're typing something into Google or Bing when they're looking for help with their child. Gemini or Copilot, I believe it's Copilot that helps you do this on Bing. The AIs are actually just giving people answers now straight away,
Right.
more
That's
so than
true.
having them go through a list of options. So, using SEO and using some more of those, I don't want to call them old school digital marketing things to do, but I guess you could kind of look at it that way. Just making sure that you're aligned from an optimization standpoint. Make sure your website and the assets that you have people looking at when you do some of your ad work, whether you want to do that in Facebook or Instagram or just like Google ad or Bing ad searches. If those things are all speaking to each other and they're all linked, and then you could theoretically say we've done this, you could have a CRM that's kind of tracking all of those things and ensuring that they all have a distinct message with distinct content that people can relate to. And it's easily digestible on their cell phones, even less so on tablets, just more so on their cell phones. Like it's easy to see, it's easy to digest. That gives people a chance to find your company, find what your company does, and to see if they can have enough of an emotional attachment to it. If they can say like, hey, we have this white glove service, we have this focus on quality and customer success, maybe we'll want to talk to that company instead of another one. So that multi-layer connection that we want to build, just so we can ultimately make that human connection, is, I think, what's one thing that can drive us in Georgia, and it can drive us in other places when we expand as well. So we're using a lot of the digital tools that we have to eventually get to that authentic human connection, if that makes sense. So
Yeah, that's good.
yeah, and we want people to be able to do that. And, it's an increasingly, cell phone screen led world. Maybe you'll see us on the screen in June, but then we'll actually be in your house helping you by August. That's kind of the
Right.
goal.
Yeah, that's
Yeah.
great. Yeah. Well, Jason, you mentioned the unique personal aspect of SadieCare, aiming for parents and community leaders to know you and your partner, Valentine. How do you cultivate that deep connection and trust with families? And what role do you see technology playing in enhancing rather than just detracting from that personal relationship?
I see technology as definitely an aid to it, but the personal aspect that me and Val have, to be honest, some of it comes from our personalities and how we just like to be personable and connect to people. And as I've said before, I believe that kind of authenticity, that kind of human connection is something that will be very valuable in this world as things continue to get a little more machine driven and large language model driven. And that's the kind of people that me and Val are. And those are the kind of people that we hire. And those are the kinds of people that they look for and hire. So as long as we continue that culture of not just connection, but that culture of giving time. I'll tell you a story, short, I'll make it short.
Sure.
Valentine and one of our other nurses actually was talking to this parents, and they were having a hard time. Their child was in hospice care. And unfortunately, this child did pass last year. But before that, the parent was having a hard time just coping with everything, helping to keep the house clean. Oh, actually, we were working with another parent and nurse that had been with them that had gone through similar things that was connected to our company as well. And not only did Val and Ashley go over to help this parent just on their off time, kind of clean up, straighten things up, help them get the things together. This was off the clock because this wasn't a part of a Medicaid thing at all. That parent slash nurse also went with them to help because she understood that, hey, I was at a low point moment too in my life. And I thought it would be helpful that I could give this back to this parent that she didn't even know. as well. She lived like an hour and some change from this parent. I believe this nurse was from like Decatur. The parent lived in like Cartersville,
Wow.
something like that,
Yeah.
and she drove all the way over there. Now in Georgia time, in the middle of the day, that you might as well be in New York. I mean, it's really
Right.
hard to get from one side
Right.
of the city to the one side of the suburbs in Atlanta to the other when the traffic's going. But they did it.
Yeah.
And I
Yeah.
think it's more, and I don't want to tell you it's like completely personality driven. I do think like with Valentine's leadership, that's just what she imbues to everyone. And that's what will be important for us to carry with us as we continue to grow, that culture. Now, how in the world is that connected to technology? Well, it can help you share that story, right? And it can help you share that story with a lot of employees that you have. Like Val doesn't have to tell the story in person. I can be on a podcast talking about it. People can see clips and highlights of it while they're seeing, and they can be like, wow, that was touching. So they're looking, as they're looking at this $1,500, cell phone, possibly in a TikTok ad, aside from all the complications with how they get the information, right? I believe that's a way of using technology to help you leverage yourself and tell the more humanistic stories that you have. So just one example, but yeah, we definitely, it's more or less like, yeah, using it to spread the word. You're helping your word of mouth, your typical word of mouth storytelling by having it come out in different ways and in different formats.
Yeah, absolutely. Well, thinking about the broader healthcare technology landscape, what trends or innovations are you most closely watching that you believe will significantly impact the in home care services in the next 1 to 2 years? And how is SadieCare preparing for those shifts?
You'll probably see more companies using CRMs, I think, like real systems of infrastructure. And the next thing in 1 to 2 years, I have a boring answer and then probably a more exciting one that your audience would like. So the
Okay.
first one, the boring answer. As I said, there's like usually a delay in regulatory bodies, providerships, things that are working with government offices because they tend to be conservative because of all the regulation, right? Well, you're definitely going to see an uptick in the next 1 to 2 years of companies like mine using CRMs to help them track and analyze information. This is about a 15 years late kind of deal, but now you're going to see smaller companies be able to leverage some of these technologies because the cost of them has come down tremendously over the past like 5 to 10 years, I think. So you don't have to sign up for Salesforce. By all means, you can go to Brevo, Zoho, some of these other smaller client software based solutions, and it's not going to cost you an arm and a leg anymore to have licenses and have users and start putting your infrastructure on something that gives you better tracking, gives you better analysis. So I do believe that's going to be a push with a lot of these industries, especially on my little side of the fence over the next 1 year or two. Boring answer. Now, clearly a more exciting answer on top of that is because this is like a 10 to 15 year late kind of thing with home healthcare companies using some of these systems. You already have AIs that have infiltrated their way into a lot of the CRMs, and they're doing things already to have them kind of be more as helpers. To your point earlier in the conversation, like Gemini is all of a suddenly very active in our Google workspace within some of the forms and emails that we're using. Copilot is doing the same on Microsoft. You're going to see a lot more AI aidship come to the fore in the next year for sure. And now we know there's agents out doing kind of things on their own. Sounds like very exciting. That kind of assistance from AIs will start to creep itself more into just your daily work schedule and some of the things that you're typically doing as well. And it's going to allow some of the people that are on your teams to do more with less. There's definitely going to be some that will affect some labor decisions, unfortunately, down the road. But you're going to really start to see AIs affect the speed at which things can happen. You don't have to think as long and hard about like PowerPoints and stuff anymore. Like some of the stuff I grew up doing working in corporate America used to take a few days to make a good PowerPoint
Agree.
presentation. Canva's AI system, you don't even have to pay extra for it. Canva can literally spit something out in like a minute, that you
Agree.
can just edit
Yeah.
it and you're good. So yeah, times have definitely changed, and it'll be interesting to see how a lot of regulatory bodies react to that. Because like I said, they were about 5 years behind implementing CRMs and things like that. Things have moved really fast with AI agents and using chatbots and phone answering services even have started to become more in use. So yeah, the next six
Yeah.
months to a year will be very interesting.
Oh, yeah, I do. I think so too. Jason, what should I have asked that I haven't or that I didn't cover that maybe our audience would be interested to know about you or about SadieCare?
Well, I did think you get to the heart of it, right? Like we are trying to figure out how to take our humanistic and take our connection, our authenticity, and how do we spread that around as effectively as possible, right? While keeping everything safe, while keeping everyone's information safe. So I do feel we spoke to the heart of that. And those are
Yeah.
all very important questions for us. I think you'll start to see more looseness and things like that, things that question that authenticity when it comes to marketing, right? So how do you market yourself as not just a healthcare company, but as businesses market themselves in general? I wonder how I don't want to when you say it's inauthentic, that does sound harsh, but you're going to have a lot of systems in advertising and marketing in place that, you're not going to be interacting with very many people in the future when it comes to these things. And I wonder how that would affect businesses like mine that depend so much on human interaction. I mean, people are making placards, flyers. They'll have pictures of people on them, but those people will be AI generated. Will people care that things are AI or robot generated? I always ask myself this when people call our number, do they care that they're speaking to an actual person? Or if they're speaking to something that sounds like a person, does that matter to parents? Does that matter to customers?
Yeah.
I think it'd be hard pressed for you to have a strong take on it. Like personally, I might not like it, but
Right.
that doesn't mean that other people won't mind. So I would be very interested to see where those things are. And it's even hard. I see why those questions wouldn't come up because it's a hard question to answer. How much are people going to care that they aren't talking to people in the future?
You
You
know,
know,
I
and that's we'll just have to see for that.
I know for me personally, initially when I would call and get just an AI agent or receptionist on the line, I didn't like that initially. But then over time, I grew to accept it and I liked it because I could get things answered quickly that just normal stuff, even calling the doctor's office and trying to change an appointment. Sometimes you sit on hold for a while and then you
Hmm.
finally get the nurse on the line and then she's trying to pull up your record and trying to figure out everything to get you that new schedule. Well, now my doctor that I go to now, he's got AI receptionist. I call up, answers the phone. If I have a question about any medical issue, usually it can answer general stuff. But if I just want to schedule or reschedule my appointment, it's done immediately,
Hmm.
real fast. And I don't
Yeah.
have to wait. So I didn't have to wait and, try to explain everything to the nurse. It's done quickly. So I like that. And so for me, I've come to accept it. But I remember in the past, I just anytime I would hear an AI receptionist on the line, I would just hang up.
Yeah. You know what? This reminds me of, when we used to see the AI videos and things like that, like last year, especially late 2004, when they really
Right,
started to come out. And they did not look very good. I mean, they looked like crap
right,
to the videos that
right.
were made. Well, now, if you take a look at some of the stuff that you can get from Seed Dance and 2.0 and Sora, these videos are starting to look pretty good.
They are.
And that's only been in a span of about 12 months. So that's why I was like, hey, this next 6 months are going to get very interesting because I think effectiveness and actual use case success will be the biggest reasons why people adopt or get on board or just get used to it, right? Because, like, yeah, for me right now, if I hear an AI assistant, I haven't been able to use them as effectively because I still have in the past calling in my head and trying to say like, "Hey, can you repeat your name and then say your number in here so we can help you when I say the number and it doesn't understand my voice or my accent or something like that." And that used to be extremely frustrating. Well, now it seems like when you call certain chats and lines, they've solved for that
Yeah,
already,
yeah.
Like they understand what I'm saying, they understand what my cousins are saying with thicker accents even, like Google Translate's just like picking them up like no problems, picking up other people in other countries
That's
with
right.
no issues at all. Like the technology is changing very rapidly when it comes
Yes.
to this. So to your point, the AI assistant was effective. So if these things are going to be effective, that's going to be the main driver of people adopting them. And so I don't know, maybe I answered my own question. Are people going to mind interacting with things that they know aren't human in the future? I guess it depends on how effective they are.
That's right.
And
That's
if
right.
that effectiveness continues to be the thing, then boy, where are we going? I guess we'll see.
I know.
Yeah. Yeah.
I know. Well, Jason, thanks so much for sharing your insights today. And I think this is going to be very valuable for our audience.
Mhm.
And yeah, this will be great going forward. But I do really appreciate your time and your openness. Thank you so much, Jason.
Hey, thank you, Donald. Nice chat. Hope to talk again. Okay.